Hi, my name is Ryan Bates. Let's do our 360. Here's where the supplies will be: gloves, hand sanitizer, prompts, patient. Let's get this set up. Okay, my name is Ryan. My name is Ryan Bates. I will be your student nurse practitioner today, performing a neurological exam on you. Can I have your name and date of birth, please?
Yeah, my name is Connor Sigelski. My date of birth is June 20th, 2002.
Good job. Let's start with testing your cranial nerves. I'm going to have you occlude one side of your nose and sniff in. Can you smell that?
Yes.
Good job. Let's go for the other side.
Yes.
Okay, good job. Can you go ahead and open your eyes for me? I'm going to check your pupils and make sure they're responding to light. And then just want to make sure that they're restricting to light. Good job. Next thing, we'll test your vision. Hold this out as far as possible. Read the bottom line that you can.
LTFPH.
Good job. Cover one eye. And read the lowest line again.
Sorry. LTFPH.
Cover the other eye.
LTFPH.
Great job. I'm going to go ahead and test your visual fields. Can you tell me when you can see my fingers wiggling?
I see them.
Good job. We'll come up.
I see them.
We'll come down.
I see them.
Cover one eye for me. And you tell me when you see them.
I see them.
Good job. Other eye.
I see them.
Good job. Now looking just at me, can you go ahead and follow my finger? Good job. I'm going to press my hand against your cheeks. Can you go ahead and clench down for me? Good job. I'm feeling your temporal masseter muscles. Great job. Can you raise your eyebrows? Good job. Can you stick your tongue out at me? Side to side. Puff out your cheeks. Good job. Go ahead and shrug your shoulders up. Good job. I'm going to press my hand against your cheek again. Push against me. Good job. Press against me again. Great job. Let's see what's next. And those are just testing the cranial nerves. Those come from inside our brain and kind of test our vision, sensory, and motor, so it moves and feels things. All right, next is just hearing. Can you go ahead and tell me
Yep.
if you can hear this?
I hear that.
Good job. One more thing, let's test let's take a look in the back of your throat. Say it, ah. Good job. Great job. I'm just making sure that we get everything. All right, next we're gonna test your motor and your coordination. All righty. Can you go ahead and make quick pats on your thing? Great job. Go ahead and put your finger out in for me. Now looking just at me, can you move your finger from the tip of my finger to your nose? And we'll move that around. Good job. And then we'll do that with the other hand. Great job, your right arm. Great job. Great job. Go ahead and put your arms up for me just like this. Push against me, pull away, or you know what I mean.
Yep.
Let's start with your left arm here. We're gonna go ahead and make a fist, and I'm gonna see how strong your wrists are. Good job. Good job, you understand the drill. Alrighty, next I'm gonna try and push down again, same as the other side. Push up, great job. Can you go ahead and squeeze my fingers for me? Great job. Can you, with your right hand, do like a big 5, and I'm gonna try and squeeze those together, test that strength, and we'll do that on this side. Thank you. Next, can you put your thumb and pinky together? I'm just gonna test your strength. Great job. Great job. While I've got you here, I'm gonna test your reflexes. This is just a reflex hammer. I'm gonna put my hand on the tendon. You relax that arm, and we're gonna see if we can get it to flex. Good job. And then we're gonna do the wrist here. Just looking for that again. Great job. Go ahead and let your arm hang loose. Great job. Let's do everything we just did on the other side. Okay. Go ahead and palms up for me. Great job. That one was a lot better. Getting better at it. Go ahead and relax that arm for me. Sorry.
You okay?
getting the tendon, just not very well. All right. Next, can I have you work on your lower legs? We're gonna have you press up against my hand with your leg. We're gonna test the hip flexion. Good job. Go ahead and do that again. Go ahead and try and press your knees together for me and press them apart. Good job. Go ahead and try and push against my hand with your left leg. Now try and pull against my hand, and with your right leg, and with your left leg. Good job. I'm gonna go ahead and grab some hand sanitizer before we touch your feet. Go ahead and press down like a gas pedal and pull your toes up towards your nose. Same on this side, and great, everything feels great. We're also gonna do your tendons on this half of your body. So go ahead and make that leg nice and loose. Great job, and for your right leg, great job. Now we're gonna test your ankle one. A little tap, great job. And your right leg. Go ahead and relax that leg for me. Great job. Having any numbness or tingling in your hands, feet, or toes?
Nope.
Great job. We're gonna have you go ahead and stand up now. I want you to walk from me to kind of the corner of that there. All right, good job. Go ahead and walk back on your heels. Good job. And then walk back on your toes. And go ahead and tight walk back for me. Great job. And I want you to stand there and close your eyes. Stand there and close your eyes. I'm going to test your coordination, just see how you do with your eyes closed. All right, good job. Go ahead and open them and hop 3 times for me. Good job. Go ahead and close them again. Hold your arms out with your hands up. Great job. And then I'm going to try and push them down, okay? We'll give you a little bit more time. All right, go ahead and push them down. Good job, great job. You can go ahead and have a seat again for me. Great job. All right, next is going to be sensory. So I'm going to use a mixture of this cotton ball and this little tiny pick. It's not sharp, it's dull on the end, but it'll elicit a sharp response. And this is what the cotton feels like. I'm gonna do your shoulders, arms, fingers, thighs, inside, outside your calves, and your toes, just to test to see how your sensation feels, okay? So I'm just gonna peel this back and you tell me what you feel on your shoulder.
Sharp.
Good job.
Soft.
Good job.
Sharp. Sharp. Soft. Sharp. 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 Soft. Soft. Sharp. 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 Soft.
All right, great job. Everything's intact. All right, next what we're gonna do is gonna be a funnier one. I'm gonna grab your toe, I'm gonna move up, down, up, down, up, down. You tell me what it is facing when I stop, okay?
Okay.
Let's start with your left foot. So we're gonna do just moving, and I'm stopped.
Up. Down.
Good job.
Down. Up.
Great job. More hand sanitizer. All right, next we're gonna use this tuning fork. I'm gonna hit it on the side of your chair, it's gonna vibrate. You are gonna stick your fingers out at me, and I'm gonna put it on the tip. You tell me when it starts tingling and when it stops tingling, okay?
Okay. Starts. Stops.
Great job. Let's do it on this side,
Sorry.
and then we'll do it on your toe, okay?
Okay. Start. Stop.
Great job. Let's do the left toe. Gotta get it just right.
Start. Stop.
All right, we'll go for the right toe.
Start. Stop.
Great job. Next, I'm gonna place an item in your hand. You tell me what it is, okay?
Okay.
Let's do your left hand. Tell me what this is.
It feels like a coin.
Great job. And your right hand.
I believe that's a battery.
Great job. Next, I'm gonna take the blunt end of this pen and you're gonna tell me what number I draw on your hand, okay?
3.
Great job.
9.
Great job. right, next one I'm going to do is I'm going to call it 2-point discrimination. I'm going to take these two tiny sharp points and I'm going to touch them together and closer and closer and closer, and you tell me when it's, tell me whether you feel 2 points or 1 point, with the goal of being finding a minimal distance where these feel like 1 point, okay?
Okay.
So you're on your left arm, feel like 2?
2 points.
Okay.
2, 2, 2, 2, 1.
That's a very small distance, that's good. That means the nerves are working. Let's do on your right arm.
2, 2, 2, 1, 1.
Great job. The last one was the same distance, I just had to retest it. Alrighty, now you're gonna tell me with your eyes closed, I'm gonna touch a point on your body, you're gonna open your eyes and you're gonna point to it, okay?
Okay.
Great job. Great job. Great job. Great job. Great job. And then next I'm gonna touch you either once or twice on your body. I want you to tell me whether you feel once or twice, and I'll go down both sides, okay?
Twice. Once. Once. Twice. Once. Twice. Once. Once.
Great job. Next we're gonna do, I'm gonna have, since we already did your reflexes, I'm gonna have you go ahead and lay down and we're gonna do a couple tests.
Okay. Thank you.
Okay. My nice exam table. First one, we're gonna have you lay straight out. And the first one we're gonna have you do is no, you're okay. We're gonna have you flex your neck, chin towards your chest to see if you have any discomfort in your back or head when you do that, okay?
Okay.
So go ahead and chin to chest for me. Great. Great, great, great. Next, what we're gonna do is we're gonna lift, I'm gonna help you, we're gonna flex here and here at your hip and your knee, and we're gonna test for any of the same pain, okay? Back or head.
No pain.
Great job. Next one.
No pain.
Great job. Next one is gonna be a straight leg raise. This is gonna test for any herniation of your discs in your back. We're gonna look for a lot of lower back pain, okay? Tell me if this hurts at all.
No pain.
Great job. And same side.
No pain.
Okay, great job. Now, go ahead and with your arms, go ahead and push up. This is just testing for any wobbling of your hands, okay? Everything looks good. Thank you very much.